Hi, I'm Dr. Dan Shapiro, plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and that's all I do. I just perform cosmetic or aesthetic plastic surgery. I do a lot of breast augmentations. I enjoy doing them. I try to be very precise with my results, and I listen. I think it's a procedure that we both come up with a plan. It's not just all measurements. It's really about what you're looking for. I try to have you make an informed decision about something that is going to look good now and in the future. And uniformly, people always want to know, Dr. Shapiro, if I have my breast augmentation, what is the recovery like after the first couple of days? And really it depends upon what someone's recovery is like. When someone is younger and they have not had children and they have very tight skin and we're putting implants beneath the muscle, I think that patient's going to be a bit more uncomfortable because, again, we are putting the implants beneath the muscle. I have to make a pocket beneath the muscle, and we are actually stretching those tissues, the skin, the muscle, and whatnot to accept that implant. So the first couple of days they are going to be uncomfortable, and there's really not a lot to do about it other than give you some pain medication, some emotional reinforcement, and also give you some Valium or a muscle relaxant to help that muscle conform to the implant. So that being said, it is not uncommon to have some discomfort for the first couple of days. It is not common for that discomfort to last for a long time. And depending upon how people present, whether they have had children, whether they have a lot of skin laxity, will kind of dictate how much discomfort they have. Obviously, if someone has a lot of muscle density or muscle mass, like a weightlifter or something like that, putting an implant in is going to be more uncomfortable with them because, again, if we put the implant beneath the muscle, we want them to be comfortable, but I need to put it beneath the muscle, so that is going to be a bit more uncomfortable because of the muscle mass. So again, we have Valium for them to go ahead and try to mitigate that. Other thoughts about the recovery is that for the discomfort, we'll also have people put some frozen peas or some ice along the top of their breast. That tends to make you feel a little bit better. We have you wear a sports bra. And really for the first couple of days, we don't want you doing too much. By about the third day, I think people are feeling much better. They're over the effects of the anesthesia and they start moving around a lot. I have a lot of patients that have young children, so obviously patients will ask me, how do I lift up my kids? They may not be heavy yet, but I don't want to strain or disrupt something. So basically what I'll tell them is that when you're lifting, you don't want to use your arms so much. You want to have your arms close to your body and use your legs for leverage. So we just want you to be smart about it and not overly strain. After that initial period, I think you start feeling much better and getting more active. So by about a week or so, we have you come back, we take the stitches out, and oftentimes we'll have you continue wearing that sports bra and wear an elastic band that helps push the implants down. Now those implants often won't drop for 3 to 6 weeks, so you have to be patient. And I think that you start to increase your activity after that first week or so. We really don't want you doing any heavy lifting, weightlifting for your chest for about 6 weeks, but within the first 2 weeks or so, you can get back doing more aerobics, you can walk, you can lightly run as long as you have a lot of compression on your chest. But I think, after about 2 or 3 days, you're really feeling much, much better. I think you also have to make sure that you have some support available with regards to emotional support. I wouldn't, do a lot of scheduled activities. I wouldn't schedule myself back to work, the second day of surgery. But just be smart about it. We do so many of these procedures that we will help you come up with a plan post-operatively to make sure that we maximize your comfort. We put your mind at ease and just realize that this is a team effort. So the best way to get an idea about how to go about all this is come in for a consultation. I oftentimes will have you talk to a patient that I've done that procedure on, and we'll come up with a plan for you. Thank you.